Hello and welcome to this lecture number 17, which is a very interesting one because in this lecture we are not going to talk just about diseases and disease control, but several other factors as I've been saying already repeatedly. Uh, Public health, medicine generally, and in this case, epidemics, were not just about encounters between diseases, pathogens, and remedial measures. All of these, the dealing with the disease, the discussions and discourse about sanitation and the measures, and all of these offered ample opportunity for a lot of cultural framings, cultural caricatures, denunciation, contestations, protests, cultural hurt, reactions, all that. The circumstances, all of this because the circumstances of the disease, whether it's the landform or the people's habits, whether it's the eating habits or excreting habits, all of these were projected in very stigmatizing ways. So, for instance, entire regions like Bengal, which had recurrent prevalence of cholera and malarial fevers, were often stigmatized as being essentially unhealthy places. And so, for instance, to give another example, Burdwan, again in the Bengal region, was initially seen as a vibrant and luxuriant place, but in course of time, so the people were seen as victims of nature, both mentally and physically. So people's minds were sapped by the environment and the body is emasculated by the powers of nature. And particularly diseases like malaria were represented as emasculating, weakening diseases that threatened reproduction and made individuals weak and sickly. So this means that malaria not only with its mortality removed a lot of people, but even if they survived, it reduced the vitality of the survivors and sapped their vigor and their fertility. So the victims of the disease were portrayed as, for instance, in this case by Bengal's Sanitary Commission in 1899. So the victims were seen as wretched beings of sallow and ghastly countenance, looking twice their actual age, with weak, attenuated frames, shrunken limbs, and with their muscles thin and powerless. And also this kind of discussion also contributed to the recurrent colonial ideology of the manly races or the martial races. So there was this distinction made between the so-called martial and manly races of the north and northwest, for instance the Sikhs and the Pathans, and on the other hand Bengalis who were seen to be weak and effeminate, and this weakness and effeminacy was correlated to their diet. So Bengalis rice diet, and also to their climate, which is damp and unfavorable to health, the rainy season being prolonged, and the atmosphere contaminated by exhalations from swamps, and with several of the districts intersected by rivers and creeks. At even within Bengal, so earlier we saw the distinction made between the Bengalis in the east and the Sikhs and Pathans on the west or the northwest. But even within Bengal, there was a distinction made between those on the western part, mostly Hindus and who fed on rice, and those in the eastern part who also ate meat apart from rice. So who were seen to be more sturdy, more strong than the Bengalis on the eastern part. So thus disease was correlated with the race and religion. And this in its own way added to the communal tensions. So as we know, like the British used or instigated the communal tensions, their time tested successful ploy of a divide and rule based on various kinds of divisions, particularly religion, in this case Muslims and Hindus. And so these kinds of discourses also contributed in their own way, because it was not only the British who were saying these things, but many of these things were also internalized. So this internalization is a very important aspect in these discourses. So many of them, the Bengalis themselves came to believe and internalize some of the things that were said. So, for instance, middle class Bengali Hindus in the western part of Bengal began to see themselves as a dying race, in contrast to the Muslims in the western part, whose members or whose numbers were on the ascendant. And even the famous historian R.C. Dutt went on to say that all those physical causes which enfeeble and enervate and make man incapable of having mastery over nature are found to exist and work in this country to an alarming extent. Similarly, a Bengali doctor, Gopal Chandra Roy, when he wrote about Burdwan fever, he gave very negative and mournful, pessimistic images. So, these kinds of images and ideas were time and again repeated, and they were widely circulated. So, many diseases apart from malaria, many other diseases in India were also attributed by the British medical men to the peculiarities of Indian climate, geography and landscape. Um, Sometimes the effect of these environmental idiosyncrasies, such as monsoon, were also aided by peculiar customs of Indians, like pilgrimages, bathing festivals, and fairs. Mm. So therefore, there was that's why this cultural element and cultural considerations come. The officials were reluctant to implement measures that might violate Indians' sensibilities or their views of social customs and status, caste considerations, and other such things. So this was conveniently used as an excuse for not acting adequately, because it was felt that some long held habits and deeply ingrained customs are too difficult to change, and it would be unwise. So, both internally, this was an argument, and also externally, it was presented to the outside world also as one of the reasons for their hesitation. And of course, it was not entirely untrue. So, in many cases, it was really the case. Um, and so, therefore, so not only could it be used as an excuse for inaction, but it could also be used to blame the Indians for much of the sad state of the health and disease. And again, as I say, we should also keep a note of things that are happening around. So while we are focusing on the world of medicine and disease and sanitation and other things, so from time to time we also have to remind ourselves about the other broader things happening. So by this time, especially after 1885, freedom movement was picking up with the formation of the Indian National Congress. So there were lots of prayers and petitions and demands and protests, which did not, all of which did not go without some kind of effect or some kind of concessions from time to time. So from time to time, we have concessions in the form of Government of India Acts. So for instance, there was one in 1909, and in this case is a 1919 Government of India Act, called as the Montague-Chelmsford Act. So one of the provisions of this 1919 Government of India Act was the introduction of diarchy in the provinces, through which certain subjects like sanitation, health and other things were transferred to the local Indian ministers in the province. So by this time, so as part of the concession, so Indians found there was the electorate which included Indians. So Indians found ways into the administration. So there are Indians who even served as ministers. So these are all the developments which are happening on the political front. But the point here is that so medicine, along with other such responsibilities, was one of those what is called transferred subject, while the British Executive Councillors continue to control more important subjects, or what they thought was more important subjects like revenue and defence. So those are called reserved subjects. So but this devolution again was presented as a move, a very generous move on the part of the British towards enhancing responsible government and giving a chance for Indians to be showing their responsibility and play a role, and to make them more accountable. But in real terms, what happened due to this so-called devolution was that it's basically the shifting of the responsibility without the accompanying supply of adequate funds. So funds is always a recurring theme. So again, this provided another opportunity, the way for shifting the responsibility of blame to the Indians. But all of this passing of the buck and the so-called restraint, hesitations, were all colored with supposed cultural concerns and restraints, the care that the British had to take to keep a safe distance and not to step on wrong toes. And actually, in some cases, the British expected that the same cultural factors about which they were always careful, anxious to tread carefully. So they thought some of them may actually work the other way around in a positive way. For instance, when smallpox vaccination was introduced, so as we saw during that lecture on smallpox, the vaccine basically was based on cowpox, and the material was actually taken from cow. That's how the word vaccine itself comes from, the Latin word vacca. And given the special and sacred stature that cow had in Indian sensibility, especially Hindu sensibilities, so there was that expectation that people would very eagerly take up vaccination, because some element aspect, part of the sacred cow's body was getting into their own body. But that didn't work that way, and when that again gave an opportunity for further distribution of certificate, cultural certificate. So in this case, so this was seen as a proof of Indians' depravity and perverse ingratitude for all the generous things that the British are introducing. This is a proof of their blind adherence to ancient usage, and also this is a proof of the degrading effects of Hindu religion. See the kind of denunciation, cultural denunciations and caricatures that discussions on health allowed the British to make. And by this time, variolation itself was cast and colored in a very negative way, as I had mentioned in that lecture. So it was now seen as barbaric and criminal, and also culturally also seen to be inferior to vaccination, both in terms of the scientific approach, and also vaccination seen more scientific, though as I said, it was still empirical without understanding the real reason, or without the ideas of immunity and antibodies and antigens at that time. But comparatively, it was seen as more scientific and also more secular, without the need for any kind of chantings and other kinds of rituals and offerings and other things. So the hesitation towards a vaccine on the part of Indians was also read through this lens of cultural preference or steadfast attachment. And all of these kinds of cultural factors, so they were not just presented as critiques. This is not just a matter of caricaturing and essentializing on the part of the British, but they also affected the British and their approach itself. So it influenced the initial approaches to a considerable extent and prompted them to adopt more mild and more negotiated approaches. So of course, the reasons was that one was of course to not to invite second mutiny and to be very careful about it, and also to bring about some level of participation to ensure some level of success for some of the measures like vaccination or sanitation. And the point about concern about rubbing on wrong shoulders was particularly felt now because some nationalists, for instance, like Balagangadhar Tilak and others, channeled the discontent that was created through these medical and sanitary interferences. So that was channeled into the larger stream of protest against British colonial rule itself. And so the colonial state was concerned that so this was also going against the divide and rule game. So now Hindus and Muslims were getting together against the British because of the common concerns and displeasure created through these kinds of cultural invasions. So we'll see some of them. For instance, with regard to vaccination, there were particular objections, and as I was mentioning, the vaccination was primarily based on material from cow, and of course it's not very easy to keep taking a calf everywhere. So what they would do is to start with the material from a calf and then do vaccination one person, and then material from there would be transferred to another person by what is called arm to arm vaccination. So which involved transmission of bodily fluids. So and you can imagine what kind of a cultural displeasure it would have evoked. So because one is about touch related pollution, and of course the and even more the disturbing aspect of transmission of bodily fluids. So many households were not very happy with giving the limb from their children's arms, and those who were particularly class conscious were also very reluctant to take lymph which was probably taken from arms of low caste children. So therefore they had to resort to ways of finding material directly from the calf. So they explored the possibility of extending the stock of calf limb indefinitely. So this would involve cost, but then at comparatively little expense, they try to keep the calf option. So this is an example of how, because of the opposition to arm vaccination, so they had to resort to this back to the other option. But this again, so whichever way you go, there is some problem. But all said and done, it's from calf, and then it was now it's not about the recipient's body, but about the where it is coming from. So it was seen as taking that from the cow was again seen as an insult, as a violation of their sacred animal. So again, so that had to be abandoned. And also there was some concern about scientific concern about the lifespan of the calf limb itself. And of course, there was also this calculation. So probably this objection could be also neutralized if it was taken from buffalo, which is kind of related material could be taken. So it's not exactly from cow. So that was one of the options considered, but the more viable option was using lymph preserved with lanolin and glycerin, so where you don't actually see the cow or the calf. So what you see, as you see now, some kind of a material. So that's what, as I keep saying, so we should always be careful about not confusing what we know of certain things with what was there. So the moment we talk about vaccine, so we think of vaccine in some kind of a bottle or a syringe and some kind of a colorless liquid. So we have to go back to that time. So when these kinds of things were not yet available, this kind of storage and transport and packaging was not available. So this is one of the earliest ways was done, was preserving the lymph with lanolin and glycerin. So then it would also be individually administered without the need to do it from arm to arm, or without involving the transmission of bodily fluids. So it was a substance which is individually administered to each person. So that was one way through which vaccination could eventually hope to succeed. And of course, there are other ways culturally. Again, this is also not from a practical manpower point of view. The use of tikadas, because they had a cultural standing, and so enlisting them, that would also reduce the level of cultural alienness. So that was another strategy. And coming to plague, so we saw anti-plague measures were sometimes too intrusive, could be too traumatizing also, the kinds of checkings that were done and all that. So in course of time, the colonial government sought to reduce the level of concentration by moderating some of those harsh and intrusive anti-plague measures. So it itself, the colonial state itself, was worried about its own young medical experts, who were in fact criticized in the report of the Plague Commission. So these young experts who were all for those kinds of very intrusive, strict and rigorous implementation of those kinds of measures, the commission felt that compulsory segregation and other such steps should be avoided, and hospitalization would be effective only if it was done with the consultation of people. So there is no point herding people forcibly to places where, because that might also matter the state of mind in which they go. And so all of this also brings up another interesting question. So can the government leave these kinds of matters to medical and sanitary officers? Because again, this was not just about medical matter. This was something which was affecting the larger relationship between state and subject. So this is also something you should keep in mind. So this is a recurring question. So for instance, people ask even today, why should certain departments not be left to experts? How will a minister or a civil servant who has written a civil service exam with, say, history and some other subject, and why should he be presiding over the health department as health secretary, or the mining department? So that's question. So why not an engineer be presiding over say a particular department related to engineering or manufacturing, say industries secretary? So so this is something we should keep in mind. So ultimately, everything that is done is as of course in a democracy, in the name of the people. So the who is answerable to the people? So who is at the receiving end in a larger sense? So in this case, what we can call the larger state-subject relationship. So now the government felt that it should play a broader, more important role in deciding the level of interference and not leaving it entirely to specific domain knowledge experts. And so one of the mitigative effects was moving in the direction of voluntarism. So enlisting the support of the people coming voluntarily to get admitted or voluntarily to have their house disinfected, rather than these things being done forcibly. So they hoped this kind of approach would have a greater public support. But there was a compromise. So when you reduce that level of enforcement and those kinds of strict measures, there would be some level of death. So there always had to be a kind of a balancing game between fear of too much intrusion and repercussions, and at the same time the high mortality that could arise because of too little action. So they were reconciled to the fact that some number of deaths would be unavoidable, and on the other hand, they could bring about steps to raise both the level of voluntary participation and also general sanitary awareness, and also a soft pedal approach to vaccination. So of course, so talking about plague vaccination, there was a particular incident which came as a sore point. So in a place called Malkawala village in Punjab, 19 villagers died when they were vaccinated, but that was because of the tetanus, which was contracted because of use of contaminated needle. So it's nothing wrong with the vaccine material itself. And so as we saw, Hafkin was a lead player who introduced this vaccine. So he was blamed, he was held responsible for this, and his name got cleared only many years later. But this accident had a very negative effect, and so of course, some of this we have again seen during our COVID experience, how there were people who were hesitant to have the vaccine, and that kind of hesitancy was also fueled by all kinds of rumors about what might happen, and or certain things that did happen to maybe some friends or others. So in this case, this was like something not too small, like 19 villagers publicly died, and was very directly related to the vaccination, not to the vaccine itself. So there are efforts to rewin the confidence, but at the same time, the vaccination was not compulsory, but even as in the case of COVID, so it was not made explicitly compulsory, though we were made to feel that it was necessary through several ways. So here also the government tried different ways whereby people voluntarily come, but at the local levels, medical officers and administrators held dialogues and consultations with community leaders about how best to implement anti-plague measures instead of unilaterally dumping those measures on them. So on the other hand, soliciting the active and intelligent, smart behavior and cooperation from the people themselves. For instance, when large-scale evacuation was involved, the village headmen were consulted in advance. And so they even went to the extent of providing traditional medicine. So sick people could be taken to a public hospital where a Vaid or a Hakim would be made available at government expense. So for those benefits who were not very comfortable with the European methods of treatment. Similarly, a voluntary system of segregation was arranged in several towns, and while doing these segregations, moving to hospitals, caste question factor was also brought in, so separate caste hospitals were arranged. And another line of option, another line open, was to promote research which could provide other alternatives to harsh plague control measures. So, for instance, the identification of rats as vectors of plague causing flea gave the option of targeting them, the flea and the rats, rather than wholesale evacuation and isolation of human beings. But again, so because this whole lecture is about this, we already mentioned the other lecture, but here we are talking about everything from cultural point of view. So here again, there was a cultural element because there were people like, for instance, Jains, followers of Jainism, and some Orthodox Hindus were against the uh, extermination of rats because they were generally against cruelty to any living form. So the whole point of this lecture is to highlight with just a few examples how there were several cultural touchstones, sensitivities and sensibilities that confronted, influenced, and mitigated measures against various epidemics. So this is across all, so across the people, the medical officials, officers, the colonial state officials. So in some way or the other, so the cultural aspect played, either in terms of hurting someone or being hurt, or in terms of being more considerate, more moderate in approach. So on that note, we will close this lecture and meet in another one. Thank you.